this video, we're going to show you exactly what your specific condition entails, how to properly treat it, and maybe more importantly, how to keep that pain from coming back for good. Hi, I'm Johnny with MJ's right here in Fulton County, Pennsylvania. I've been treating this area and the surrounding areas for well over 12 years. I have 30,000 plus hours of actual hands-on experience in eliminating conditions just like yours. I hope you find this video valuable, and thanks for watching Pain Elimination TV.
Alright, kind of a scary, interesting picture to start off a video with, isn't it? Alright, we're going to talk about your condition today. Your condition being TMJ. Very serious condition. It can cause a lot of pain. It can interrupt even with enjoying the process of chewing some of your favorite foods. It can cause headaches, and if it gets bad enough, which I've only met one person so far where it's been this bad, but because of the location of where some of the muscles are in relationship to the ear canal, it can actually do everything from cause vertigo type symptoms, uneasiness, off balance, but it can also create a situation where you can begin to lose your hearing and even go deaf. Now, some of the muscles we're looking at, this one here you're very familiar with. Most people are familiar with the temporalis. This is where a lot of people get some of their headaches. It's the biggest, strongest muscle, facial muscle that you have, and it is attached to this particular bone here, your mandible, which is going to be greatly involved in TMJ dysfunctions. Of course, the chewing of your food, gum, and so forth. We're also going to be looking at the masseter. Now, the masseter has two heads. This is kind of what they refer to as the superficial head, and this is going to be what they refer to as kind of the deeper head. Okay, you can see where it comes back here and attaches to the bone. In here, you're going to have the lateral pterygoid, the inferior portion, and the lateral superior portion. And then you're going to have its brother down here, the medial portion. Now, what happens with TMJ? Usually we find that TMJ is created from two specific situations. One is a serious, some kind of surgical procedure within the mouth itself. Perhaps the mouth is extended open too wide. Or something goes wrong during the actual surgery, and then somewhere down the road, it could be a week later, it could be instantaneous for some people, and all of a sudden they have TMJ. A lot of people with TMJ can hear the clicking of the joint. Their spouse may even hear grinding of the teeth at night. But the number one cause that we have found for TMJ is literally stress. We have to understand that a lot of the muscles, and we're not seeing a lot of the muscles here on the face with this particular clip because these are the specific muscles that are involved in TMJ. But you have to understand that the muscles of the face have some pretty interesting, unlike most portions of the body, in self-expression. So when we think of this area here and some of the muscles going inside here and this big bad boy here, they are involved in expression. And most people are running around in the fight or flight mode, stressed out, and these muscles are going to cause the jaw to clench. Now, any muscle in the body that is in protective mode too often and too long, especially big, I mean, these are powerful muscles when we think of pounds per square inch. They become chronically shortened and very tight. They're very tender to work on, and they can cause so much discomfort. What we want to look at is another muscle here. And of course, this is showing you the action. This is why you get a lot of tension in this area. For some people, it feels really good to massage this area. For some people, it can be very painful to massage this area. You can see inside with some of the stuff that's going on here. Now, for most people, you can resolve their TMJ by doing some really deep work out here and some passive-aggressive active stretching. Yes, believe it or not, you can stretch your TMJ joint, your jaw. For people who are in really bad shape, and I have met a few of these people within my career, you have to put on, a latex glove, and you have to go inside here and work on these particular muscles inside the jaw. So you would actually have the person with their jaw open, and you would come back into here and really work that muscle out, really give it some good stretch and stimulation, creating some great positive blood flow. And you can get some pretty astonishing results by going on the inside as such. We do a lot of cross fiber on this muscle here, and cross fiber means nothing other than, as you can see, the fibers running in this direction, so the deep tissue massage would actually run in this position. With this muscle here, it responds really well to circular style massage and a little bit of cross fiber, which obviously would go in this direction. But one of the best things for TMJ is a passive-aggressive activated stretch. It's where the thumbs are applied to these 2 points right here. And you would push down on your bridge of your jaw, relaxing the jaw and even assisting in the opening process. With that being said, once it gets as open as far as it can go at that point in time, you would very gently engage these muscles and kind of pretend that you're trying to close your jaw, but you're not going to force it shut. You're just going to be stuck at a stalemate between your thumbs and your jaw muscles. You would hold that position for anywhere from 3 to 5 seconds, and then you would relax the jaw muscles and push even harder on these 2 points, pushing the jaw open as far as it can go to its next sticking point. It might be a little hard to understand without seeing it in action. That stretch alone can resolve TMJ, which would be done preferably, we would prefer that it's done 3 times a day, once in the morning as soon as you get up, somewhere in the midday throughout the process of the stress of the day, and then once right before you go to bed, because these muscles have the tendency of getting really tight and drawing up in the midst of the night. But just that stretch alone, being taught how to do that properly, can get rid of TMJ in less than 14 days. For a lot of folks, I've noticed within less than 7 days, as long as it's done consistently. Now, once you get your TMJ properly treated and you have resolved the problem, there are a couple things you can do to keep it from coming back. One is you want to avoid extremely tough foods being consistently in your diet. So for somebody who's always chewing steak, that could end up causing a problem. If you're an advocate gum chewer, you potentially would either want to cut back on your gum chewing or cut out gum chewing altogether. You could also occasionally, because you do not want to forget, because once somebody feels good, they usually forget they had a problem. And 9 times out of 10, most people do not resolve the life issue that created the problem, so the problem has a tendency of coming back. Since this one is greatly stress-induced, unless you're going to learn some good stress management techniques, the odds are this will attempt to come back. So you would just want to massage this on your own. Very simple. Just take your thumb and you just do some cross fiber, or you would take your thumb and bring it down into this notch here and just push back with some force. And as you're pushing back with some force, you would then just open and close your jaw. Okay. Then the best technique to keep TMJ from ever returning is to occasionally not forget to do the passive-aggressive activated stretching. Now this was a short quick, sweet to the point video. I hope this helps you better understand your TMJ problems. And if you've been experiencing a lot of headaches in this area, the odds are it's in absolute relation to this area. And I hope this video was worth your time.
I hope the time you spent watching this video was valuable. Now, if you want to be pain-free within 30 days or less, please give me a call. Let's talk. Phone number is 717-404-6495, and you can sign up for our pain elimination package, which guarantees with your specific condition, we will eliminate that pain in 30 days or less with a satisfaction guarantee. If you're not satisfied at the end of the 30 days, you get your money back. And our pain elimination package is half price. So if you want to get rid of your pain in 30 days or less, give me a call. And thanks for watching Pain Elimination TV.